Okay, we are live. Welcome everybody to another episode of our Divine Farmer Health podcast. My name is Jimmy Yen, the AcuSensei, and I've got my partner Chris McKee, Nutritionist, and we've got a hot topic today. We're coming to you for those of y'all, we're coming to you from Texas, where we are currently in a cold front. Our temperature dropped 30 degrees. We're not in the 110 degrees Fahrenheit. We're actually in the 70s now. So I actually have my jacket on because we're in a cold front. So it's going to
Yeah,
be a cold winter.
hallelujah.
And also, so today's topic is cholesterol. And so Chris, why don't you start us off? What do we want to
Yeah.
talk about cholesterol?
Well, I'll tell you why I wanted to talk about this because as a lot of I do one-on-one consultations, and I do, a lot of people in my, 60s, 70s, even 80s. And I find so many people are on statins and they don't even remember what their cholesterol was when their doctor put them on it. And they just kind of take it, and they don't even know what cholesterol does. So I love to educate people on cholesterol because I think it's been the bad guy for so long that people don't have a clue what it does in the body and how important it is in the body, and to maybe question whether or not you need to be on it as you're aging. And I have some really interesting new research on that as for the older population. But just to give you a number, 92 million people in the United States are on statins. 92 million people. That's a heck
Wow.
of a lot of people. um, and I thought it would be really interesting to read you a quote. And this is from a Dr. Dwayne Gravelin, who has kind of changed his philosophy on statins and having done a lot more research on it. So I'm going to read you this quote. There's a big word in here that I will define for you. Okay, I had to go look it up. I actually didn't even know what it meant. So statin drugs cause effects on our mitochondria. Okay, we've talked about mitochondria a lot on this podcast, right? That's the part of your cell that produces energy. So statin drugs cause effects on our mitochondria, identical to those that accumulate with age. One might say that one side effect of statin therapy is premature aging. First, I learned about statin drug inhibition of glial cell cholesterol, so vital for memory. So glial cells are in the brain. Then I learned about the inevitable mevalonate, that's the word, mevalonate blockade by statins with resulting neuropathies, myopathies, and chronic muscular degeneration. Many statin victims say they abruptly, almost in the blink of an eye, feel like they become old people. So that mevalonate pathway is fundamental for cholesterol synthesis. It's one of the most important metabolic networks in the cell. So these statins are not just, I think we think, okay, well, gee, my lab work shows my cholesterol went down by 20, 30 points, Yahoo. There's a whole lot more that it's doing in the body. So I wanted to kind of dive into what cholesterol does in the body because most folks don't know this, right? They don't have a clue. So we have, and I have a cold, so don't mind me if I'm clearing my throat. But you have all your cells in your body, right, that have a membrane. They have a fatty membrane, a lipid membrane around the cell. And so your body depends on cholesterol as one of the primary fats to make that membrane and to make it fluid so that things go in and things come out, right? Nutrition goes in, hormones go in, all kinds of things go in, and toxic waste comes out, whatever metabolic process that's done in the cell, and it has to get out. So cholesterol is important for the cell membrane. It's the precursor for all of your steroidal hormones. So progesterone, estrogen, testosterone, cortisol from the adrenal glands. You need cholesterol to make all these hormones. So think about this when you're aging and you're not, like for women, right? My menopausal women, we're not making as much estrogen and progesterone as we used to. Men aren't making as much testosterone as they get older. And we don't have the right, if we're on a statin and our cholesterol is really low, we're not giving the body the raw material to make these hormones. And yes, we do make them even after menopause. A lot of people don't think so, but we don't just dry up and not make any hormones. Yes, we do make hormones. So Cholesterol is really super important for that. It's the precursor for bile acids. So this is where I'll often see where people are having digestive issues, gallbladder, digestion, fat issues or whatever, and they're on a statin. They don't realize that what the statin will do is lower your bile production, which comes from the liver, goes into your little storage unit, your gallbladder, and then puts it into your gut so you can digest fat. So if you're having digestive issues and you're on a statin, you might look at maybe that's what's causing it because you're not making the bile acids that you should be making. And then finally, it's needed to manufacture vitamin D, which is super important for our immune system, right? So vitamin D is a fat soluble vitamin. Also, because the bile production is reduced, you're not breaking down and utilizing your other fat soluble vitamins like A and E and K. So these are vitally important for long-term health and vitality, and also have a lot to do with that cellular function. So cholesterol is really important in the body. We need it. The glial cells in the brain, interestingly enough, the research shows now that your brain makes cholesterol, not just your liver. We always know your liver makes cholesterol, but your brain glial cells make cholesterol. And when you take a cholesterol medication, it actually lowers the cholesterol in the brain as well. And so there's a correlation between memory loss and statins. So that may be the connection right there. So there's a
I
whole
wonder if
lot. Any
it's,
other additions to that, Jimmy, on the cholesterol side?
well, I'm wondering, so glial cells, you're talking about glial cells. The first thing that came up to my my brain
Yeah.
was if you take cholesterol medications, it decreases your cholesterol production within your brain, which every
Yeah.
single cell needs. Does it make you stupider if you take cholesterol meds? I, I'm wondering if they did that research, right?
I
Intelligence,
don't know. They did research
right?
on memory.
Because yeah, so I would think if if your memory's going down the tubes, then your intelligence most likely is going down the tubes. So
Yeah.
I want for those of y'all who are watching, if you're taking statins or cholesterol medications, we're going to do a informal survey. Have you noticed that your IQ, your intelligence has decreased since you've been taking cholesterol medications? I'm just curious, right?
Yeah.
I'm sure the pharmaceutical companies will never do that research because they don't want to admit they're making you dumber. But going back to, so that was just the thought that came to my brain.
Yeah.
But
Yeah.
another thing is, like in my practice in our clinic, we've noticed with cholesterol meds, because we treat, you mentioned, cholesterol's the side effect of statins. One of them is neuropathy,
Yeah.
and we treat a lot of neuropathy and neurological conditions in our practice. So we have definitely seen a direct correlation between statins, neuropathy, nerve damage. We've also seen a direct correlation with statins and muscle problems. Like a lot of
Yes.
times people have, I would say the number one side effect of statins is some type of muscle ache, muscle pain, so forth. And 100% of the time, when someone comes in with that, they've taken a statin and they have these side effects of muscle problems. When they stop the statins, their muscle symptoms go away. That
Yeah.
has been 100% in our practice. So I just
Yeah.
wanted to throw that data out there.
Yeah, and for my own husband, I know we experienced that with him. He started getting muscle wasting, where it was literally
Hmm.
eating away at his muscle. So it's
Yeah.
it's not just the pain, but it's actually causing muscle degeneration. And then you
Yes.
talk about neuropathy and the nerves. So the cells that I'm talking about, are nerve cells are incredibly dependent upon fat for the myelin sheath, which is the major, connector between the neurons and everything. So that myelin sheath needs fat. And so I think that's probably one of the reasons why you see the side effects with the cholesterol and nerves. Yeah.
One thing before we continue on, of course, we always need to throw in a disclaimer. We are not medical doctors. We are not physicians. We are not telling you to stop your medication. That is not what we're telling you. We are here to provide you with more information so you can have a more educated discussion
Yeah.
with your physicians and you can talk with your physician about, hey, should I be taking this statin or not?
Yeah, yeah. And I think that's a really key thing is I don't think, again, people realize how important cholesterol is in the body. And so that's why I wanted to bring this up today, because whenever I educate my clients, they're kind of their jaw drops. They're like, I had no idea that cholesterol does all that stuff in the body. So it's actually there for a reason. um, so let's talk about HDL and LDL, because of course, when we get our labs done, we see HDL and LDL and then the total cholesterol, and they base your whether you're on a statin or not based on that. Well, some of the docs are waking up, right? And some of the cardiologists are waking up, which is good. And they're realizing, well, there's a whole lot more than this, just HDL and LDL. So HDL, yeah, HDL is the good cholesterol, because what it does is it removes the excess cholesterol out of the bloodstream, takes us back to the liver for the liver to process. So we want our HDLs up in the 60 range, somewhere around in there. That's a good number. But LDL is really complicated. LDL has particle sizes. And so you can have a high LDL and actually have it not be damaging LDL, because it could be large particle LDL. And the small particle LDL is the one that is the most damaging, because it can get down into that endothelial lining in your vessels and your arteries. And so when you get your labs done, I really encourage my clients to ask for a more in-depth LDL panel. And you can get this done, and your insurance always covers. I'm a big one for sending my clients back with a list of labs. Like, go ask your doctor to do these labs. And, most of the time they will do them. So I think that people aren't, like they think they can't ask for them. Yes, you can. You can ask for a lot of things, like get your vitamin D done right now. Super important going into the winter, right? So ask for labs, because the small particle LDL, it's definitely the bad cholesterol. But let's talk about why these things show up on the scene, right? Why does LDL show up on the scene? I love this analogy. Let's say there's a car accident and there's two cars involved. There's a bad accident. Somebody calls EMS and the ambulance shows up on the scene, and they start blaming the ambulance for the accident. You would think, well, that's really dumb. But we do that with cholesterol, right? Inflammation and oxidation show up first. They are the ones that are damaging the arterial wall and the blood vessels, the inflammation, oxidation. And then the cholesterol just comes up along it's trying to help by kind of repair things, right? It's like a little cement, kind of coming along and repairing the damage that was caused by the oxidation and inflammation. So it isn't the enemy. It is actually doing something in the body that it was meant to do. So we've blamed cholesterol for so long for arterial plaque, when in reality, like Jimmy, you and I talk about this all the time. Go deeper, right? Why did your body have damage to the arterial wall or the blood vessels? What was it that was causing the damage in the first place? It's inflammation and oxidation. So oxidation, think about taking a piece of metal and putting it out in the rain, all like it just rained here, right? So put it out in the rain all winter long. And in the springtime, you're going to have rusted metal, and that's oxidation. So in the inside of the body, we're rusting out. And so that's why we eat antioxidants, colorful fruits and vegetables, right? To prevent oxidation. So the cholesterol is doing its job. It's just that we want to lower the need for the cholesterol to do that. Did you have any thoughts on that one?
Yeah, I would say, that's a great analogy about the ambulance. Actually, I just responded to a question on our Facebook feed, and
Yeah.
that was my answer is, this is one thing that we've noticed in our practice, and we've treated thousands of patients. And so the cholesterol, cholesterol, cholesterol is usually a lot of times the scapegoat. It's not the cause. One of the question was, does cholesterol cause hypertension? It could, but it's not the root cause. The root
Right.
cause, like Chris was saying, is the inflammation. But then that's actually not even the root cause. If you think about it, that's not even inflammation is not the root cause. what caused inflammation and oxidation within your arteries in the first place. That is the root cause. And that's what you need to talk with your, healthcare provider and your physicians. Like you were talking about doing extra labs, you need to, because more information is better. There is not one diagnostic test, there is not one lab test that will tell you the exact root cause. No medicine has that. As maybe some people may say they do, but they don't, right? So the key is you need to get more information, do more labs, and gather more data so you can see which culprit is really the true culprit. If you don't solve that, you can take cholesterol meds all you want, right?
Mm-hmm.
It may give you the fake number that you are doing well, but you're not. Your body, like earlier on you said, statins cause us to age faster. So I don't know of anybody that wants to age faster, or maybe
Yeah.
kids. Okay, kids want to age faster.
Yeah.
But
Yeah.
once we get like, especially like my wife, after she passed 21, she's like, okay, I'm never getting older. I'm always going to stay 21, right? I don't think anybody wants to age faster. So
No.
if you want to age faster, then you cover your symptoms. That's how you age faster. You just
Yeah.
like cover it up. It's like is it the ostrich that puts their head in the sand?
Yeah.
Like
Yeah.
the world's burning down and they just put their head in the sand like, okay,
Yeah.
so I don't see it, so it's not happening. But
Yeah.
just because your numbers, your labs, and this is also labs, if you're taking medication, it can give you false information as well. Because you can take
Yeah.
cholesterol medications and your cholesterol numbers will be down, and your physician is going to tell you, oh man, your cholesterol is great. No, it's not. It's the medication that is superficially suppressing it. Still
Yeah.
haven't fixed it. You still have chronic inflammation. That will lead to other chronic inflammatory diseases. Like we're saying right now, it affects your glial cells in your brain. It makes you stupider probably, right? So maybe you're thinking, man, why can't I remember things? Right? Because you're masking it. So you have
Yeah.
to find the root cause. And labs, we love labs. Do they tell us everything? No, they don't. But we love it because it's more extra data.
Yeah. Yeah. And I think that if you have like a genetic tendency, like my brother-in-law, it had like 400 on cholesterol from the time he was 20s, right? I
Wow.
mean, crazy numbers, right? So
Yeah.
genetically, some people are like that. And then if you have a long history in your family of heart disease and everything, you might want to get these deeper labs, because if you do have really high small particle LDL, there's things you can do. So let's talk about that, right? Because even if you do have high LDL, you might want to look at why is it high in the first place? How did it get there? Is that the normal status for the body? If it's not a genetic thing, is that normal? Well, we know for sure that sugar plays a role in elevating cholesterol. And
Mhm.
so somehow that got missed for so long, right? That sugar didn't have anything to do with cholesterol. No, it has a lot to do with cholesterol. It has a lot to do with triglycerides going up too. And so we have to go back and look at diet. What are we putting in our mouth that is causing some of these shifts in the cholesterol numbers? Because one of the things that people also forget about is alcohol. Alcohol's sugar. And I put a post on our Facebook page, and I think we'll probably get some people like, I'm not giving up my alcohol. But I mean, once or twice a week or something. But if you're drinking it every night, or especially I find women do red wine a lot, it's going to it could very well raise your cholesterol numbers, your triglyceride numbers. And so there again is a root cause, right, of why are these numbers creeping up. The other thing too is as we
Chris, really
age.
quick. Chris,
Yeah.
really quick before because you just mentioned about sugar. So I actually
Yeah.
just Googled because I remember. So in the 1960s, the sugar industry paid off Harvard researchers to manipulate the data to say that, oh, obesity, all these chronic diseases are due to fat and cholesterol. So the sugar
Yeah.
industry paid off the like medical schools to manipulate the data. So
Yeah.
that's why, to answer your question, why we never looked at it, why nobody ever looked at sugar correlate to cholesterol because the research was being manipulated in the 1960s. You can Google it
Yeah.
yourself.
Yeah. Go that far back, right?
Yeah.
That's amazing. I don't think people were even aware of it. How it's so interesting because I look back on when you used to have labs done. If you were running 220 or something on your cholesterol, you were fine. I ran 240 for a really, really long time. And my HDL and LDL ratio were really, really good. And so they never put me on a statin. But as I got older, they wanted to put me on a statin. And I'm like, no, wait a minute. It was okay like 10 years ago, but now all of a sudden it's not okay. Because it just got pushed more and more, right? And then they want it lower and lower. And I'll have clients come in where their cholesterol is like at 139. And I just about freak out because I'm just like, oh my gosh, that is like, I have to be really careful, right? Like you said, we're not medical doctors, but I understand, if they're coming to me with all these problems, I understand the cholesterol cascade and everything it impacts. And so, getting lower isn't better, just
Yeah.
isn't. So, the high carbohydrate diet, the high sugar diet will absolutely impact your cholesterol numbers and your triglyceride numbers. And those diets increase inflammation in the body, right? And oxidation in the body. So we want to get our bodies, we want to eat an anti-inflammatory diet. We want to eat a diet rich in colorful fruits and vegetables because they're the antioxidants that help squelch and put the fire out of the oxidative damage and the inflammation that's caused at the cellular level. So it's super important that we do this. It's hard if you've been a soda drinker or a Starbucks, cruise to the Starbucks, it's hard. Lifestyle changes are really hard for people, but tackle one thing. Just say, okay, this is it. I'm making my mind up. I'm making a decision. This one thing's going, right? Maybe it's the sodas, or maybe it's the Starbucks, pumpkin spice latte right now is, that's like the big, I say this is the beginning of sugar season because we were just in the grocery store and it's aisles of candy for Halloween. So it starts now and it goes all the way into January. It is literally October, November, and December.
Well, you got February because you got Valentine's, so it doesn't stop.
That's right. Yeah, we get 1 month off and then it's Valentine's Day. It's just sugar season right now. It's just everywhere. So, decide on one thing and make a decision that this is it. I'm going to move this out of my diet and then watch and see. We're looking at cholesterol today, but there's a lot of other numbers that we can look at. If you can look at labs and look at inflammation numbers and stuff like that. So that's really important. Eating a high fiber diet, because the fruits and vegetables, I really encourage people to get their fiber from the fruits and vegetables. And yeah, oatmeal is okay, but it seems to be like that's the answer for everything, right? Oatmeal. In our programs, we don't even let them eat oatmeal because again, it's just something that we've gotten so used to being programmed that, your Cheerios and your oatmeal were all heart healthy. And fruits and vegetables really are the things, and you get a combination of the soluble and insoluble fibers. So soluble fibers being like your apple pectin and your apples are really, really good. Your insolubles are going to be things like your bran or something like that. So it's more of a scrub brush on the colon. But you want to get those the beans and legumes are going to be a little bit more insoluble and they help lower, right? They help lower cholesterol. We've seen that, a lot of studies on that. But soluble fiber is what pulls the cholesterol into the colon and then moves it out through the bowel. So 5 to 10 grams a day of soluble fiber is really good. And we are, I know that we really promote fiber in a lot of our programs. And we give people a fiber chart. You can download fiber charts off the internet, but you want to shoot for 35 grams a day of fiber. And in the United States, we run around 10 to 12 grams on average. Bad. So we want to get the fiber up, in the fruits and vegetables fibers, and we want to get the sugar down, and we want to get the foods into the anti-inflammatory family to really help lower the cholesterol into a healthy range. And then the body won't have to come along, the ambulance won't have to come along. Do you have any thoughts on that, Jimmy?
Um, well, I was looking at the questions. So
Oh yeah.
here's the benefit. Here's the benefit of y'all being live with us is you can ask questions and we're going to answer them. So one of the
Yeah.
questions was, does the statins raise calcium levels? So for me, I don't know. So I did a quick search, and there's actually a research that's done by the American Heart Association. And I'm just going to read it word for word, just part of it. Okay. Studies
Uh-huh.
show that in humans, increased coronary calcification has been observed starting after about 6 years of statin treatment.
Interesting.
So what does that mean? That means after 6 years, when you take statins, your arteries start to harden. That's what it means, right? Your
Calcification.
coronary arteries. Yeah,
Uh-huh.
calcification will result in, so our arteries are supposed to be flexible, right? They're supposed to be flexible, not hard. When they calcify, just like if you think about like those of you who have like a Keurig machine, and it gets all the
Yeah.
calcification and
Yeah.
it blocks it starts blocking the water. Well, imagine that happening in your arteries. And they're saying this is in your coronary arteries, the arteries in your heart. So
The
we're
big ones.
imagining those arteries hardening, not flexible. They can't expand. So what does that mean? If they can't expand, that means they become more narrower and narrower, and potentially heart attack, right?
Yeah.
So that was
High blood
a I
pressure.
just
Yeah.
yeah, I just read that, so that was pretty interesting.
Do we have some more questions in there?
Let's see. I answered most of them. Healthy
Okay.
fat, like, okay, so healthy fat like coconut milk or olive oil. Yes,
Yeah. Yeah.
yeah, those are healthy fats. So one thing we want to make sure whether it's the food industry or it's, we don't have a lot of, I mean, it's not just big pharma. There's many big whatever that are not helping our health in the US. So big food is also an industry. They want you to eat more. That's how they make money. Okay. They don't want you healthy. They want you fat and they want to put additives in there. So it makes you want to eat it even more. So
Yeah.
you have to watch the food that you eat. And really quick, I just came back from Asia and I had the same experience as my friends who went to Japan, who went to Italy. The food here actually in the US is worse. So, a lot of people in our programs, they're asking, oh, what if I can't get access to certain foods? Well, actually, if you're outside of the US, you have better quality food than we do. Um, but if you're
Interesting.
eating in, so if you're in the US and you're like, what do I do? That's why, Chris and I, we promote you have to go organic because if you don't, a lot of the foods are starting to become genetically modified.
Yes.
Um, you did a post, I think you did a post about, what was the word?
Bioengineered. Yeah.
Yeah, it's bioengineered.
Yeah. That's what they're
Like,
calling it. Yeah. Yeah.
yeah, that's not food. Okay, that's
No.
what's happening here in the US. But
Yeah.
that's not allowed everywhere else in the world. It's allowed
No.
here in the US.
Yeah. It's not allowed in
So,
Europe. Yeah. It's
yeah,
bad. Okay,
so
back to
definitely.
back to the fat, the question on the fat.
Mhm,
Yeah, the olive oil, the coconut oil, those are great. The seed oils are the really highly inflammatory fats, like the canola oil and the corn oil,
mhm,
fats that are used. And you'll find those in the seed oils, you'll find those in packaged foods, frozen foods, obviously
mhm,
fast food. So if you can steer away from those because they are very inflammatory. Remember the cell membrane. We started off talking about the cell membrane. If that's the only fat you're giving your body, then guess what? It has to incorporate it into the cell membrane. And then that causes that inflammation, oxidation, and then the calcification that you were talking about. So it's just this cascade of things, right, that happens in the
yeah.
body from these inflammatory foods. So that's a really good question. I think somebody had another question.
We can look at the chat.
Just
They put in the chat. What about honey and cane juice or coconut water?
Okay, so coconut water is fine. It's usually pretty low in sugar. Cane juice. not sure what that is. I've never heard of cane
Sugar
juice.
cane. So yeah, that's in Asia.
Oh, that's in Asia. So maybe
So
maybe you can talk to that.
yeah, so it's from sugar cane. I mean, it tastes
Uh,
really good. Okay. But it is just sugar. It is all
yeah,
sugar. So
yeah,
even though it's natural sugar doesn't make it right to overly consume sugar,
right.
even if it's
That's
naturally
key.
sugar. And the way cane juice is made, like I remember when I was a kid in Taiwan, they would have machines. They would just get the sugar canes. They just put the sugar cane into the machine, and
Yeah,
it's actually what it's like one of those juice extractors. It
yeah,
gets
yeah.
rid of all the fiber. It gets rid of all the fiber, and all you're left with is the fructose, which is the poison, right?
Right.
So when you just drink cane sugar, that's poison. Just
Yeah.
like you drink fruit juice, you use a juice extractor, that's poison. You need the fiber. Now you can't eat sugar cane. So I would just say use little of that cane juice.
Yeah, moderation and fructose,
Yeah.
which is high fructose corn syrup is really bad, which is in your sodas. Honey is wonderful food. Honey is especially raw honey. It's been around for thousands and thousands of years. So honey is wonderful. I love it. Somebody asked about, does exercise matter to your heart? Well, absolutely.
Yeah.
Yeah, exercise is going to raise your HDL. I'm not sure that it lowers LDL, but it definitely raises HDL, which are the little carriers that carry the excess cholesterol out of the body into the liver again to get put back out to the bowels and the kidneys. And so somebody asked about meat or fish, which is preferable. So fish is obviously lean, but red meat is if you're eating a grass-fed red meat, which is not going to be super high saturated fat. And remember, most of the meat in the grocery store is raised in a factory farmed meat, confined feeding, and they're feeding that soy and corn and things that a cow was never meant to eat. So if you can get grass-fed beef, we actually found a butcher in our area, somebody told us about, and we went and talked to him about buying a quarter of a beef because it's really expensive to buy grass-fed beef. But we're going to buy a quarter of a beef and put it in the freezer, and it's a lot less expensive, and it's grass-fed locally around here. So there are places like that if you hunt them out. We had to hunt. you know, it wasn't something that was like right around the corner. We literally had to drive like 45 minutes and go talk to the butcher. So but meat, and again, everyone is different. So I wanted to definitely tell people about the Boston Heart Health Panel. And as many of you guys know, I'm way over 65, so I have Medicare. And the Boston Heart Health Panel was covered by Medicare. And we didn't, I had researched it, and we'd gone back to my husband's cardiologist and said, will you write a requisition form for us to get this done? Because Medicare covers it. And he goes, yeah, I guess I got a requisition form around here somewhere. And he actually went out and found one, right? But the Boston Heart Health Panel, if you have a concern about either genetics, your family, or you want a deeper dive into what you're going to get way more information on the small particle LDL. You get a lot. You get genetics in there. You get some genetic testing in there. They're looking at a lot of inflammation markers in that panel. And so somebody's got their mic on. I can hear you guys talking. So it's definitely a Boston Heart Health Panel. You can look it up online. You just go to the website, Boston Heart Health, and you'll see it. But that is a really deep dive. And for some people genetically, like for me, what I found out when I did it, because I went ahead and did it on myself, was that I'm a high fat absorber. So in other words, so this is really funny because, when the keto diet came out, when was that, 5 years or 6 years ago or something? I thought, okay, I'm going to try this on myself just because, I can't recommend this or talk about it unless I've done it. So I did keto, and I was doing those, what are they called? Butter drinks in the morning, butter coffee in the morning. And I was doing all this high fat stuff. And my cholesterol went up 20 points in like 3 months. And then later on I had this test done, and I am a fat absorber. So I absorb fat really good, which isn't good. So I have to be, I'm not a super low fat eater. I eat my coconut, my grass fed butter, my coconut oil, my olive oil, but I just can't be a keto person. So again, if you're interested, Boston Heart Health Panel is a great lab. Okay, we're running over time, I think.
Yeah, so that's going to be it for today. I'll end with, if you like what Chris and I are talking about, and a lot of the stuff that we're teaching is not something that is theoretical. It is stuff that we have done with our own patients, and so it's proven to work. And we've been able to uh, create programs, online programs for it. You don't have to be here in Texas. You can be anywhere in the world, and you can take advantage of our really, it's almost like our test. We've used it, we've trialed it, and we've proven that it works. So if you're interested in getting our help, go to divinefarmerhealth.com, where actually we have a program right now. It's a 12-day rebuild program, and it's to help you start rebuilding, your main organs in your body. This can definitely help with cholesterol. We have other programs that are better for cholesterol, but if you're just want to, get your foot in the water just to see what we have to offer, highly recommend you get into this 12-day rebuild program. Again, go to divinefarmerhealth.com, and we'll put the link down there in the comments. And I'll let you know that there's one bonus that we're adding that is different. I'm pretty sure you're inundated with all these online health programs and so forth. So what's the main difference of our programs? And besides content that actually works, you're going to get my QRA acupressure videos. So that no other health program contains that. So sign up ASAP, 12-day. I forgot what was the deadline. I'll put the deadline of when we're going to close the enrollment. So get onto it now, and so you can get on this foundational program. Is to help you build a foundation for all your organ systems. All right.
Yay. Awesome.
We will
Thank you,
see y'all
guys.
all. Yeah, thank you for watching and tuning in. We love it. We love your questions, and we will see you next week.
Yes.
Bye.
Bye.